right, it's 3 minutes past the hour, so let's start the first PHEMS Meet-Up. Warm welcome. It's my great pleasure to welcome you to this first session titled Toward Pediatric Health Data Space. My name is Pekka Kahri. I work in Helsinki University Hospital and I'm interim coordinator of our EU flagship project PHEMS. And I will share with you now some of the basic ideas and thoughts that we have behind this topic and how we are working towards building a health data space for pediatric care and pediatric research. The structure of the session will be such that I will first give an introduction to the topic, about 25 to 30 minutes. Then we will enable the microphones and cameras, and there will be an interactive session allowing discussion, Q&A, and engagement with the other participants. The presentation part will also be recorded and later made available on YouTube channel so that you can also revisit the topic or share it with your colleagues who couldn't make it today. Our series of meetups this fall consists of 4 sessions that will be held like this on Tuesday afternoons each month. So today I will be presenting the starting point, how we are going towards a pediatric health data space. In the next 2 sessions, we will be focusing more on how the technical and the logical structure of the data space will be built. First on federated data networks on Tuesday, October 22nd, and then on the design of the pediatric health data space in terms of governance and relationships on November 19th. Then on December 17th, the first session of this semester will focus on a clinical use case. So how we are using the pediatric health data space and PHEMS project in building a benchmarking for cardiology operations. And this series will then continue in next semester with new topics. When looking at our topic for today, so we're going towards pediatric health data space. So it's maybe fair to first discuss what are data spaces, what are we walking towards. So there are certain definitions that are available. For example, by the European Commission in their working papers, data spaces are defined as common data infrastructures and governance frameworks which facilitate data pooling, access and sharing. There are also not-for-profit associations that are working with data spaces in several industries where data spaces are, for example, defined as systems to enable data sharing through data spaces characterized by uniform rules, certified data providers and recipients, and trust among partners. Also, another definition is that there are digital environments that are designed for trusted data sharing and utilization, enabling efficient implementation of advanced services and solutions. If looking at what does this mean in practice, it's that data spaces can be seen as a set of shared rules and shared technical infrastructures which allow collaboration around data. Data spaces can be built on various industries, health being one of the more challenging and difficult domains of building data spaces because we are dealing with sensitive data which is highly regulated. But still, we are aiming to build a health data space for pediatrics. And what is the motivation for that? It is clear that there is an urgent need in pediatrics to make data sharing better, to make it timely and to make it safe. Pediatrics is specific in a sense that when we're talking about pediatric patients and rare diseases, there are typically very small number of these patients in each country. So it always puts limitations on how to conduct research, develop new therapies and improve patient outcomes unless you can pool larger patient numbers together. And in the current regulatory environment where transferring sensitive personal level data across borders is extremely difficult, if not impossible. So this small number of patients really hinders advances in research and therapies development. Also, when we have new therapies or treatments that are coming available in hospitals, we would need to follow up on their effectiveness in real life. This is why we need ways for making data available for health technology assessment and for regulatory purposes to evaluate treatment outcomes, which again comes to the constraint of small patient numbers, and accumulation of this evidence is too slow if relying on individual centers. If we want to collaborate with the industry, so that engage with the medtech or other innovation ecosystems, large data sets are typically needed, for example, for training and validation of artificial intelligence and machine learning tools. And again, single centers may not be able to provide sufficient amount of data. Then in many countries, there are only one or very few children's hospitals, especially that are delivering tertiary care, the most demanding care for children. And therefore, there are no local or national benchmarks which would allow quality improvement, performance and efficiency improvements through benchmarking. So international collaboration is needed for these hospitals in order to improve together their performance and patient safety. With this need, so we started the project which we call PHEMS. The abbreviation comes from, as in many European projects, from a longer name, which is quite long in our case. So we are talking about how pediatric hospitals can be European drivers for multi-party computation and synthetic data generation across clinical specialties and data types. So the core idea with this name is that we are talking about pediatric hospitals in Europe. We're looking at computation that is done by multiple parties, and we're also relying on synthetic data. We're not restricting ourselves into single patient groups or single data types, but really looking at what would be the ways to do this collaboration in various clinical subgroups or patient groups, and how to address different types of data, including data from patient records, from imaging, and from other sources. The PHEMS project is funded by the European Union. So it's a 3-year project that now has been running for about 1 year. We received a 7 million euro grant jointly from Horizon Europe and the UK Research and Innovation Agency, and we have 14 partners in the project, and the coordination is done from Helsinki University Hospital. The Department of Children and Adolescents at HUS is leading this project, and we have a great set of partners in the project, including hospitals and universities from 6 countries. So Erasmus Medical Center from Rotterdam, Sant Joan de Déu Children's Hospital from Barcelona, Children's University Hospital Latvia from Riga, Great Ormond Street Hospital from London, and the Mayo Children's Hospital from Florence, Italy. There's also the collaborative organization called ECHO, European Children's Hospitals Organization, which is partnering in this project. In addition to the hospitals, there are technical and business partners involved. Tietoevry, being a large Nordic IT provider, is one of our technical partners developing the IT infrastructure. Aridia, a UK SME, providing advanced tools for trusted research environments. Veil.ai, an SME specialized in privacy-enhancing technologies, namely anonymization and synthesization of sensitive patient data. The Hive, an expert organization really specialized in data harmonization and common data models, and Genesis Biomed, a consultancy that is supporting us in building sustainability and business case for the project. Our core mission with PHEMS project is to support cross-border access and use of health data from pediatric hospitals. So we aim to increase access to health data while protecting and maintaining patient privacy. We want to do this by advancing federated data analytics and also include advanced analytics such as predictive modeling and machine learning into the capabilities of the federated architecture. We are building capabilities on how we could use and generate synthetic and anonymized data sets that could be shareable and used with less restrictions than real sensitive patient data. And then we want to demonstrate the value of all these activities by doing 3 clinical use cases in our participating hospitals. The project will create this decentralized and open health data ecosystem, which we have now started to call the Pediatric Health Data Space, which will include technical components and governance frameworks that allow collaboration without individual hospitals or data controllers need to let go of the control over their sensitive data. A very busy slide trying to capture the project overview. I will try to walk you through this diagram very briefly in this session, but it includes the core elements of our project activities. First of all, it includes a technical infrastructure. We have in our project aim to build a federated analytics network where 4 of the participating hospitals, HUS, Erasmus, Gauche and Saint-Jean-de-Deu, are working together to harmonize their data sources and to build a federated network so that data queries and data collaboration can be done without the need for any of the data controllers to release any sensitive personal data out from their own environment. The analytical and the federated network serve the different use cases and it will be managed by a governance framework where we agree how the rules and activities of the federated analytics network are built. It is a combination of technical data definitions, of business rules, how costs and revenues are shared and handled in the collaboration, and all the legal requirements, including necessary agreements and terms of use for engaging with the data network. To validate the results, we have as main activities 3 clinical use cases that are validating whether this approach can work in real life and whether it adds value into the clinical activities. I will come back to the 3 use cases a bit later, but one of them is focused on benchmarking of certain patient group. Here it's cardiology patients. Then there are two other use cases that are more focused on algorithm development, one focusing on pediatric intensive care, and a third one on hematology. There is also validation activities of how new parties could join the data network. Our partners from Riga and Florence, so Meyer and Becus hospitals, they are validating from the perspective of newcomers. How can a hospital that is not participating in the actual core development, how could they join the activity? What kind of requirements there are? And are the rules that we are creating, are they fair for newcomers so that they, in reality, this activity can grow into a larger data space, not just consisting of the 4 initial hospitals that are doing the work in the project. And then as a final entity here is the dissemination exploitation, including business models. And here the business models, of course, mean how do we make it economically sustainable? Building this type of federated architecture and collaborative setup does require certain resources. It does have some costs, but it also provides some opportunities for data users to tap into larger data resources that are not available for them currently. This meetup series is also one important part of our dissemination activities. We hope to build a network of interested parties. At first stage, especially hospitals who would be interested in following our development and potentially joining the activity in the later stages of the project. Our 3 clinical use cases are demonstrating the impact and the usefulness of the PHEMS architecture. The first use case is focusing on cardiology operations benchmarking. So the idea is that we could do benchmarking, create standards and promote the culture of benchmarking, which allows then pediatric institutions to learn from each other, to adopt best practices across institutions. This use case is led by GOSH, and it provides a framework and a model how any subspecialty in pediatrics could build a benchmarking operation in an efficient manner and use as much automation as possible so that the benchmarking data collection would be done automatically after the initial efforts, whereas currently, as any of you who might have been part of benchmarking operations, especially international benchmarking, it requires quite a lot of manual activity for collecting the data. In our 4th session this semester, Andrew Taylor from GOSH will present in detail what are the interim results from use case 1 and the cardiology benchmarking use case. The second use case is on pediatric ICU, where we want to investigate how this ecosystem could help in developing, training and testing algorithms to predict sepsis on a large scale between pediatric intensive care units in the participating hospitals. This use case is led by Sant Joan de Déu Hospital from Barcelona, and the aim is to build federated learning architecture so that we can do machine learning AI model development in a fully federated manner without the partners needing to release any sensitive data from their own systems. The third use case is on hematology, namely hemophilia patients, where there is an aim to develop and test a machine learning based prediction algorithm that would improve the treatment of pediatric patients with hemophilia. This work is led by Erasmus University Medical Center in Rotterdam and Sofia Children's Hospital. And here the results will directly feed into the treatment optimization of the hemophilia patients in each of the hospitals. All 3 use cases are participated by all the hospitals. So we truly do a collaborative effort in these 3 areas. And also the hospitals associated or following the development, namely Riga and Meyer, are actively participating here. The core idea that enables this federated activities is a common data model. And the clinical use cases are using OMOP common data model as far as possible as the harmonized pediatric data, which can then be processed in a federated manner. Then the other area which we are investigating in our project is the potential of fully anonymous or anonymous and synthetic data. If data is identifiable to the patients, its use is highly restricted or even forbidden in any secondary purposes like research or development. Under data permits or ethical approvals from the data controllers, pseudonymized data can be used for research, and a traditional research use often removes direct personal identifiers. However, these pseudonymized data are still considered personal data, and they have to be protected and safeguarded as strictly as personal data, any other personal data needs to be. This means that the processing of these data is much more restricted, much more difficult, and especially moving around, releasing these data is practically impossible in Europe nowadays. Then there is a potential of using fully anonymized data where there is no identifiable information, or creating synthetic and anonymous datasets which would rely or based on real data but not be directly linked to any real patient data. And in our project, we are investigating how these types of datasets could be generated and whether they are useful for the real clinical questions that we are working with in our project. Very briefly about our project organization. So as any European project, we are divided into work packages. A lot of focus in the beginning is in defining the architecture of our technical implementation and also in defining what are the data processing functions that we will be using, and then the clinical use cases and the validation of the approaches is done in work package 4. The governance, the legal, business, and technical requirements, including cybersecurity and privacy topics, are developed in work package 5, where we are planning to release a playbook, which would be a sort of a guide or a handbook that can be also benefited by other projects who are working in a similar type of topics of data sharing or data spaces as we are. And then we have the regular communication, dissemination, exploitation, work package, ethics, and project management. This concludes my introduction and presentation. As said, this is the first meetup of a series. Our next meetup will be on October 22nd, same time on a Tuesday afternoon. You can already register to that one. And as said, so this presentation will also be shared in YouTube channel that the project has. So feel free also to revisit the topic at your convenience.